Hey, Mr. Reynolds, how are you doing today? Good, how are you? Not bad. My name is Yonny, I'm a behavioural analyst, and what we're going to be discussing here today is about Steve's tantrums. I'll be asking you a series of questions that will help me identify the number of factors that may be influencing the occurrences of Steve's behavior. It should only take about 15 minutes. Before we get started on it, I want to know a little bit more about Steve's behavior.
Okay. Well, basically, it's tantruming. I mean, it would be exactly what you would picture. You know, it's yelling and screaming and laying on the floor, kicking his legs, flinging his arms. You know.
Do you know how many times it happens in the day?
I guess it all depends. It varies, to be honest with you.
Yeah.
When he's at home, it can happen anywhere from 2 to 5 to 6. I mean, 6 times a day it's gotten up to. So
Yeah, really.
Yeah.
Do you know if this behavior may occur at school too?
Yes, it does.
Yes, it does. Perfect. Thank you. So, the question that I'm going to be asking you is called a functional assessment screening tool. It should, again, only take about 10 to 15 minutes. Let's get started.
All right.
So, you're, of course, the parent of Steve. And how old is Steve?
He's 6 years old.
6 years old? Perfect. And, of course, you're interacting with him on a daily basis. And you're interactive in like the morning, right? The self-care, like when he gets ready.
Yeah, we get him up and get him ready for school. Yeah.
And meals, of course.
Yeah.
All right. Now the first part is going to be based on the social influences on the behavior. Does the behavior usually occur in your presence or in the presence of others? Yes. And does the behavior usually occur soon after you or others interact with him?
Yeah. I mean, it does.
For instance, like when you're giving like a verbal reprimand, or when you're giving a demand placed on him for asking to like clean up his room, or
that
stuff like that. Yeah.
Yeah.
And the behavior usually accompanied by like emotional responses, such as like yelling and screaming, of course.
Yes, of course.
All right. So the behavior often occurs when he doesn't receive much attention.
I mean, it depends. I mean, he can go outside and play outside in the backyard for 2 hours. I mean, you know, he can have his lunch and go outside and play outside for the afternoon on the weekends. But if he wants me to play with him or his mother to play with him, then and we don't, then yeah, I mean, that can cause it for sure.
Now, when the behavior does occur, you or others usually respond by interacting with him when he engages in the inappropriate behavior that produces the attention. Is there any other behaviors that like follow that, like other than the yelling and screaming?
No, that's about it. I mean, he first will yell and scream a bit, but then, you know, if you don't see what's wrong with him, or even if you do, sometimes he'll end up on the ground, you know, kicking and yelling as well.
Now, when the behavior does occur, you or others usually respond by interacting with him in some way, by like a comforting statement or verbal correction or reprimand.
Yeah, I mean, somebody always goes to see what's going on when he's kicking and screaming. Yeah.
And usually when that occurs, like, do you tell him to stop or whatever?
Oh, of course.
Yeah, of course. Yeah. Does he usually stop after, or?
Not so much.
No?
Not so much, no.
The behavior rarely occurs when you give him lots of attention, right?
Yeah, if I'm spending time with him,
Yeah, it doesn't really occur. When you take a particular item away from him, does the behavior most likely to occur?
Yeah, I mean, if he's playing with something and we tell him it's time to come inside and he doesn't want to come inside, then yeah, we'll take whatever he's playing, or take him from whatever he's playing, and that he doesn't like that very much.
triggers it right away.
Yeah.
Will he go straight into his yelling and
Yeah,
screaming?
he'll start yelling right away.
Now, when you tell him that you can't have that item, or you tell him that you can't go here, or we can't do that certain event, behavior occurs right away. Yeah. Now, when you give him what he wants, does the behavior occur still?
No, I mean, if you give him what he wants, he'll take it and he'll go off and play with it, and that'll be
Tantrum will stop, or his tantrum will never begin.
Yeah.
Now, does Steve often engage in like other inappropriate behaviors other than yelling or screaming?
Well, he's pretty good.
Yeah.
He's pretty good. I mean, he is polite and and generally kind, but this is just gone too far.
How long has this behavior been on for?
As long as I can remember, he's 3.5, 4 years old. I mean,
So for a couple of years now,
Yeah.
it's been going on. All right. Now, does behavior rarely occur during like training activities or when you place other types of demands on him?
no, that's actually when it occurs. I mean, if I'm trying to show him how to do something, like something new, like we're trying to show him how to help us out with taking things out to the blue box. And, no, I'm doing the garbage, but the blue box and stuff's not so bad.
Okay.
I mean, he just didn't want to learn, and then obviously we tried to force him, but who's going to put up with the kicking and the screaming and the yelling, right? So.
Okay. All right. Now, the behavior often occurs during like training activities when he's when he's asked to like complete a task.
Yeah.
Yes. Is he often like non-compliant during these training activities or when asked to complete a task?
If you get him to do it, if you can get him to do it, then he's not too bad. But if you're trying to force him and he's kicking and screaming and you still try to force him, then it's impossible.
Now, does behavior occur when the environment that he's in at that moment, if it's loud or noisy?
No.
No?
No.
And when the behavior does occur, do you say you tell him to do a task and he's tantruming, you leave him alone, and then do you ask him to redo the task later?
We have, but it's never worked out, so we don't do that anymore.
Now, does behavior rarely occur when you place few demands on him? So when you leave him alone, does behavior occur?
Not usually. I mean, unless he comes to us and wants something and we can't give it to him.
Okay. Last part. Now, the behavior occurs frequently when he's alone or by himself.
Not at all.
Some of these questions are repetitive.
Yes.
Now, the behavior occurs at a like relatively high rate, you would say?
I mean, some days are worse than others. Like I said,
Yeah.
I mean, it can be up to 6 times a day. So, I mean, if he gets home at 3:30 and it happens 6 times a day, he goes to bed at 8. That's more than once an hour. It's pretty high to me.
Yep. Does he seem to have few known reinforcers or like anything that will like stop him from you can give him that will stop him from tantrum other than a preferred item?
Yeah. I mean, if he's wanting us to play with him and I do go play with him, he'll stop. Or if he wants to go, to the dollar store, he likes to go to the dollar store, and we just try to tell him no. And sometimes my wife, and I'm guilty of it too, will give in to him, and that'll stop. So
It's okay. Now, is he generally responsive to social stimulation? So
no. I mean, he's got his friends from school. They all play outside on the street.
And do you know if that behavior occurs to them too? When he's around them, so say they're interacting with him, and then
school, like I said, school it does, but I've never seen it outside, to be honest with you, until we tell him it's time to come in, and he's got to put something away or whatever.
Would he tantrum? Say he's outside, and you're asking that. Would he tantrum outside?
Oh.
Yeah. When he engages in this behavior, you or others usually respond by doing nothing, or
No. Somebody always says something.
Someone's always around. Okay.
Yeah.
Now, is there like a certain cycle? I know you're explaining it before. It happens about 8 times, and can happen a maximum of 6 times during the night. So it's a very high rate. But say you're on the weekends, do you notice it high in the morning, or do you notice like a pattern? Like if the morning is he's not really yelling or screaming in the morning, and then through the afternoon it starts to increase?
Not really. I mean, it again, it depends. I mean, some days if we're going on an outing, you know, if we have plans to go to the park or something like that, and we go to the park, and it may not happen all day. We get home, you know.
Okay.
If it's a good day, you know, and each day is like different days.
Yeah. I hear you. When he is sick, does the behavior occur more often because he wants more attention, or
not really. I mean, when he's sick, you know, either my wife or I will take the day off to spend with him. So, you know, we're pretty much there all day, every day when he's sick. So.
And the last question: does he have any history of like a recurrent illness, sinus infections, or allergies? Okay. So we're all done here. So pretty much what I'm going to do is I'm just going to review my questionnaire here, and I'm going to be getting back to you. What I want to do is set up another appointment for me to meet Steve in person, either at your house or because you do work, I can talk to the school and arrange something with the school to maybe sit in and do an observation to see the occurrences of the behavior and get a little bit more exact definition of how the tantrum is, and just to gather up some more data about him, and then we'll go from there.
Okay,
does that sound good?
Sounds great.
Perfect. You know what? My assistant is out there, so you can grab a date and like a card with my number on it, and I'll give you a call within the next week or so.
Sounds
okay,
great.
Perfect. Thank you.
Thank you very much.
Have a great day.
You too.
Thanks.
Bye-bye.
See ya.
Okay, we're not going to... Alright, we're done. I forgot to show you mine. Here's my MASS, Motivational Assessment Scale. Alright. Completed. Done. And there's Yonny's FAST. I did a MASS. M-A-S. Yonny did a FAST.
I did a FAST.
F-A-S-T. Thanks, Laura.
Thanks, Laura. See you later.